Hi everyone, welcome back to the Vision Refocus channel where we discuss all things eye health and vision related. I'm Dr. Kevin Cornwell, and today we're going to go over another sight-threatening eye condition that we sometimes hear about, and that is retinal detachment. We'll go over what it is and how it occurs, risk factors, as well as some common visual symptoms to look out for. We'll end by looking at how retinal detachments are treated, as well as discussing whether or not there's anything you can do to avoid developing this sight-threatening eye condition. Let's jump right in. So what is a retinal detachment? Basically, this is a sight-threatening eye condition that can lead to permanent vision loss and blindness. It occurs in about 1 in 10,000 people per year and results from the retina separating and detaching from the other layers in the back of our eye. Our eyeball is made up of 3 different layers: the sclera, the choroid, and the retina. The sclera acts as the outer protective shell of the eye, while the choroid is the middle vascular layer, which brings blood to and from the eye. The retina is the innermost layer. Before we continue, I'd like to quickly review the anatomy and function of the retina so all this makes a little bit more sense. The retina is a thin sheet of neurosensory tissue that lines the back of our eye and plays a crucial role for visual function. The retina collects all the light we see in our environment and sends that information back to the brain for processing via the optic nerve. The macula is the part of our retina responsible for our central vision, including facial recognition, reading, and driving. Within the retina, we also have something called photoreceptors that help us differentiate color and motion, as well as help adapt our visual systems to different lighting conditions. Our cone photoreceptors are primarily responsible for our daytime vision, interpreting colors and seeing fine detail, while our rod photoreceptors are more responsible for night vision, peripheral vision, as well as sensing motion. So if you're an astronomy enthusiast or you've ever gone stargazing, you'll know to use your peripheral vision to help you see better. This is because our rod photoreceptors help us see better at night, as well as help us identify motion in our peripheral vision, such as the case with a shooting star, or back in our hunter-gatherer days, a predator. Our cone photoreceptors are primarily located in the macula, while our rods are scattered throughout the entire retina. Each day, the rods and cones undergo a recycling process in order to keep up with the visual demands of our environment. An example of this would be when our eyes dark adapt at night or when entering a dark room. At first we can't see that well, but eventually our rod-mediated vision kicks in and we're able to see a lot better. The same process occurs when we wake up each morning and our cones become activated as the environment brightens. Patients can experience a retinal detachment for many reasons, but let's take a look at some of the most common. We'll start by looking at posterior vitreous detachment, or PVD for short. As we age, the gel-like substance inside our eye breaks down and begins to detach. This process is very normal, occurring in most people over time. When this happens, patients can experience new onset flashes and floaters in their vision. These eventually settle and become less noticeable over time. This process can become a problem when a new hole or tear in the retina forms as the gel pulls away and causes traction. This process is how most retinal detachments occur. When a hole or tear occurs in the retina, fluid can then leak underneath the layers and increase the risk for a detachment. Another risk factor associated with retinal detachment is nearsightedness, or myopia. People who are nearsighted are up to 10 times more likely to have a retinal detachment than someone who is not nearsighted. Eyes that are nearsighted are stretched extra long, causing light to not focus properly and making our vision blurry. If you think about the pizza dough analogy, as you stretch it further and further, eventually you're going to have some thin spots, holes, and tears. The same phenomenon can happen in the back of our eye. Uncontrolled diabetes can also lead to retinal detachment and permanent blindness. When diabetic retinopathy occurs in the retina, new blood vessels can grow and proliferate into the vitreous gel that we just looked at. This network of new blood vessels is like a spider web that pulls and causes traction on the retina, ultimately leading to an RD if left untreated. Other risk factors can include family history for retinal detachment, prior trauma to the eye or head, or prior history of an eye surgery. Typically, patients who are having a retinal detachment will be symptomatic for abrupt changes in their vision. Many people report a sudden onset of new floater spots or cobwebs in their vision, accompanied by intermittent sparks or flashes of light. New shadows or the sensation of a curtain closing over the vision can also occur. These symptoms may increase with eye movement as well. And depending on which part of the retina is involved, patients may still have perfect central vision. In fact, visual prognosis after treatment tends to be better when central vision remains satisfactory. Any case of retinal detachment requires a prompt evaluation with a retina specialist. Visual prognosis depends on a variety of factors, with best results typically occurring when retinal detachments are treated within 3 days from when they initially happened. Many different options for surgery exist for when a retinal detachment repair is necessary. These are performed on a case-by-case basis and at the discretion of the surgeon. These include vitrectomy, sclerobuckle, cryopexy, and laser photocoagulation. The insertion of an air or gas bubble may also be warranted. This can help mechanically push the retina back into place. Visual prognosis varies on a variety of factors and is largely dependent on the duration of the RD and whether or not the retina was detached at the macula. Some vision is usually recovered within 4 to 6 weeks after surgery. Unless both eyes are affected, most patients are still able to perform their daily activities after surgery. Patients may continue noticing flashing lights and floaters in their vision even after surgery. Depending on whether or not a bubble was placed in the eye, patients may also be required to lie face down for up to 2 weeks. Patients who have lost vision and have blind spots may benefit from an evaluation with a low vision specialist. These are typically optometrists who have access to custom visual aids such as magnifiers and telescopes to help patients better use their remaining vision. A low vision evaluation for someone who's lost even a small amount of vision can be a life-changing event. Oftentimes, patients are not referred to low vision until a significant amount of vision has already been lost, but this doesn't need to be the case. Sometimes just learning what tools are available can be useful and help restore hope for patients. Patients will often ask if there's anything they can do to avoid developing this sight-threatening condition. We usually recommend annual dilated eye exams for adults, especially for those who are nearsighted or have a positive family history of retinal detachment. Other modifiable risk factors should also be addressed and managed as well. There's also many new treatment options for slowing the progression of nearsightedness in children and adults, which ultimately lowers the lifetime risk of having a retinal detachment. These include specialty hard and soft contact lenses, spectacle lenses, and pharmaceutical eye drops. So there you have it. I hope this video provided some more information on retinal detachment. If you or a loved one have experienced a retinal detachment and care to share your story, please feel free to leave a comment. Also, if you have any ideas for eye-related topics you'd like to see covered in a future video, please let me know as well. For more information on eye health and vision, please check out the other videos on our channel and consider subscribing. Thanks again for watching, and we'll see you in the next video.